And so a big piece of my work is trying to reconnect people back to spirit, which really the avenue to that is through nature. Many of us have forgotten how to be spirits, spiritual beings on this planet. We're all about grab and go, more, me, more. It's all about my needs. My job on the planet, small task, is to get people reconnected back to nature. And so in my clinic, I do that by providing actual herbal teas, not bags, not tea bags. I try and make them tasty. My patients might disagree with that. I try and make them beautiful. I put flower petals and things in so that they have a heartful connection to nature, and it hopefully makes them more aware of everything of how they operate in the world, including things like the food that they choose to eat, just by giving them herbal tea. My not so very hidden agenda to change the world.
Welcome to the Herbalist Hour. This is where community gather, merging the power of people and flowers, the sweet and the bitter to the salty, the sour. Umami, it's time for the Herbalist Hour.
Welcome back to the Herbalist Hour. Today I'm really excited to have on Chanchal Cabrera, as well as a special guest host, Aron McNicholas. Thank you so much, both of you, for joining us.
Thank you.
Thanks, Mason. Thanks for having us.
Of course.
Saturday to talk.
That's right. Well, Chanchal was episode 3 of the Herbalist Hour, and we had to have her back. But we want to delve more into this whole herbalism cancer topic. And I felt, that's way over my head. I'm not an expert in the realm at all. So it's great to have Aron on here because I know you study that quite a bit, Aron. And in fact, you're going to be visiting Chanchal here in a couple weeks, I want to say, staying with her for a few months or a couple months. And we'll definitely delve into that event that you'll be there for. But in the meantime, since we are going to be talking about herbalism, cancer, and all the above, I want to just say a disclaimer before we get into the show. The information in this episode is for educational and entertainment purposes only. It is not intended as a substitute for advice provided by your physician or other medical professionals. Always consult a healthcare practitioner before using any herbal remedy or food, especially if you are nursing, pregnant, or have any medical condition. Chanchal, do you think that covers it?
I think that's fair and appropriate, Mason. Yes, it's definitely, we very much want to support people to be taking care of themselves and being proactive and all those good things. And that doesn't replace medical advice. And a herbalist should really be working right alongside of the medical professionals, offering fully rounded care.
Absolutely. Just to kind of, plug and promote Aron's projects, you can check them out at Heartwood Herbals. That's heartwoodherbals.weebly.com. As per usual, links will be in the podcast show notes in the YouTube description. Aron's also a podcast host as well. It's called Awaken Indie. So, dear listener, please pause right now and go subscribe in your podcast player of choice. You can find it all over Spotify, Apple Podcasts, etc. And Chanchal's work, you can learn more at chanchalcabrera.com. Also, Chanchal wrote another book. It's called Holistic Cancer Care, an Herbal Approach to Reducing Cancer Risk, helping patients thrive during treatment and minimizing recurrence, which I'm sure more will come up about your book in this podcast episode. So there it is right there. If you're on YouTube, Aron just held it up. Great. Well, thanks to both of you for taking the time today. I'm going to kind of hand it over to Aron now, and thanks.
Well, Mason, thanks so much for putting this together. I think you're such a great voice for our community, and I really appreciate what you do to connect everyone, because it's a lot of hard work probably behind the scenes. And yeah, I just really appreciate it, man. So thanks for what you do. And Chanchal, thanks so much for being here. You have such a wealth of knowledge, and you're kind of like one of my herbal superheroes. So this is like a great chance, and I feel like really blessed to have this today. So yeah, thanks to you guys both for being here.
Thank you.
So yeah, we're kind of diving into the realm of cancer support. And I think it'd be kind of just interesting, Chanchal, if you kind of walk us through, in your opinion, why are we seeing a rise in this condition? I think, back in like 1971, when Nixon declared the war on cancer, I think the rate was like 1 in 7, 1 in 8. And now it's, I think, projected to be like 1 in 3. And so I'm curious, why might we be seeing this trend?
Yeah, that's such a great question, Aron. And, I don't have all of the answers, but you are right. It's between 1 in 3, or in some statistics now, they're saying 1 in 2 people are going to see cancer in their body in their lifetime. Now, to be clear, that isn't always a catastrophic diagnosis. That could be a mild basal cell carcinoma that's readily treated in your GP's office. It could be a ductal carcinoma in situ in the breast, which is even getting reframed now as perhaps not a true cancer, but more of a precursor, almost more like an abnormal pap smear. So, there is a huge amount of cancer out there. There's also a whole lot of different ways it gets counted and measured and assessed. And so there's always a discrepancy, I guess I'm saying, in the numbers. Nonetheless, I think it's fair to say that it is on the rise. Why is that? Well, I don't have a great crystal ball, but a few things that have definitely factored into this rise, Aron. We are living longer. So we definitely are having just more years of cell replications where errors could occur. So that is certainly a plausible part of the reason that we're seeing more and more cancers as we age. However, the cancers that are going up the fastest right now are in younger people. It's actually not our seniors that are getting more and more cancers. It's actually rising in young people. Breast cancer, for example, the most rapid rise is in women sort of under 30, under 35. So what is going on with that? I believe personally, my understanding of it is that is largely because of epigenetics. That is environmental factors influencing the way our genes behave. So you're born with your set of genes. It's the deck of cards, the hand of cards that you got dealt. But how you play them does make a big difference. You get the genes you get, but which ones are operational, which ones are active, which ones are dormant, that is called epigenetics. That is how the environment influences our gene behaviors. So, for example, the unbelievable amount of xenoestrogens, the amount of estrogens in our environment, residues of agricultural chemicals, plastic breakdown, plastics around our foods in particular, drugs that are getting into our water supply that are then getting back into the food chain. These are definitely contributing to the rise of estrogen-driven cancers, which are growing very fast at the moment. Not just breast, but lung, brain, bone, melanomas. These also have estrogen drivers. And so definitely the hormones in the environment a factor. I personally believe that a lot of it is from our diet. We are eating more and more sugar, less and less vegetables, more and more junk. Well, something's got to give. So it's a perfect storm, really, where we are putting things into our bodies that shouldn't be there. We're not putting in things that should be there. We're living a life that's so far removed from the natural rhythms that cancer is the consequence of that. So it's a whole lot of factors, but largely environmental, and a lot of it is self-inflicted, by which I do not mean to blame the patient. I mean, as a society, as a culture, we are inflicting this upon ourselves.
That's really a great point at the end. I'm a big fan of, he was kind of an Austrian philosopher. His name is Rudolf Steiner, and he often thought that culture and civilization itself was a large contributing factor to the spread of disease. And I think nowadays, like you mentioned, the diet that we eat, being inside all the time, on technology, I mean, so many factors. Where do you even begin, right? And I was even wondering if you could speak to even some of our diagnostic testing, because I think I read a study the other day that said, if you follow the allopathic prescription of mammograms and you went that through your lifetime, following that recommendation, that you had like a 50% chance of having a false positive. And that might lead to over-prescriptions and over-diagnoses and treatments. Is that something too that you might even see?
Yeah, there's some really good points you're making there. First of all, I'm going to say that some people believe that we humans are the cancer on the planet, actually, using up our resources, messing in our own beds. Perhaps we are the problem. I also want to pick up on your comment about Steiner, because I have studied a lot of Steiner's work. I lived for several years on a biodynamic farm, which is, of course, the agricultural inspiration from Steiner. And I've also, because of my master's degree at the Scottish School of Herbal Medicine, we studied a great deal of Steiner's work at that time, and Goethe, who was Steiner's inspiration.
Yes.
And so that whole master's degree was premised around studying the work of Goethe and his approach to studying nature. So I'm very familiar with all of that concept. And, you know, what Steiner was so great at was finding loose threads and following them through to the knot in the middle and untangling that knot and making sense of stuff that the rest of us would just stand back and say, whoa, that's really interesting. And Steiner would somehow get right in there and find the connections between things. And he looked at the gaps as much as the things. He looked at how things fit together in nature, the patterns of nature. And as a herbalist, that has become very, very interesting work for me to try and get out of some of the judgmental, linear thinking that we get inculcated within school, and try to think a little bit more holistically, bigger picture. And Steiner's work and Goethe's work are definitely, for me, big influences. In terms of diagnostic techniques, Aron, it's a really good question, because, you know, if you look hard enough, you'll definitely see something, right? So you mentioned mammograms, and I don't actually have the statistics to hand about if you do so many over the course of your lifetime, what is the increased risk of breast cancer because of the compression of the tissue, because of the radiation, and also, as you said, the false positive. So I mentioned previously ductal carcinoma in situ. That has traditionally, up till now, been identified in mammograms at a very early stage. So you can look at the history of mammogram diagnostics and say, well, we're catching cancers earlier, and that is a good thing. The sooner you get it, the better, you know, sooner you get into treatment, the better. However, what that doesn't factor in is how many of those DCIS cases, ductal carcinoma in situ, had they not been identified early, how many of them would have resolved on their own? Because actually, just like an abnormal pap smear, I'm not advocating for ignoring significant health findings, but I am saying that ductal carcinoma in situ is massively diagnosed, massively over-treated, treated as full-blown breast cancer with all of the invasive procedures that come with that. And it's a bit like taking a sledgehammer to drive in a thumbtack. Most people with DCIS don't need mastectomy, chemotherapy, radiation, and tamoxifen. They need a much more, a much smaller protocol, very focused, very targeted, but not as systemically toxic and invasive as that. And most of them will do fine. So what I'm really saying is that mammograms are over-diagnosing. They're making the problem bigger than it actually is. Now, of course, in the statistics, this is very helpful because to the medical model, because what that says is, first of all, women live longer with breast cancer than they had used to, which implies that treatments are working. But actually, that's not the case. Women live longer with breast cancer because they're being diagnosed earlier. So of course they live longer. They're also being diagnosed with breast cancer and entering aggressive treatments that possibly are unwarranted. So, and the false positives also happen. There are also false negatives. In fairness, no test is 100% and no technician is 100% either. So there's always, you have to assume a margin of error. But, you know, diagnostic techniques have changed and improved vastly. What's most interesting in the world of cancer today, though, isn't necessarily the diagnosis of your tumor per se. You have cancer, you don't have cancer. Obviously, that matters hugely to the patient, but for therapeutic purposes, for treatment planning purposes, what's really exciting today is studying the genetics. So since we've cracked the genome, says she, as if I had something to do with it, since the genome was understood better, there's been an ability to look inside of the cancer cells at how they behave and use that to plan treatments. That is really exciting. This is now, cancer treatment is moving into a new realm. Now, I have copies of old covers of Time magazine going back over 20 years. There's about, I don't know, 6 or 7 covers in the last 20 years that Time magazine has done about the new medicine, the way of the future, the customizing, the targeted treatment. And so we've been talking about it a long time. It's just becoming, I'm not going to say standard of care yet, because some of the smaller remote northern hospitals are definitely not caught up yet. But in the next 5 to 10 years, you're going to see a complete revolution as how cancer is treated. It won't be one size fits all. You have lung cancer, non-small cell lung cancer, take this drug. No, it's not going to be that anymore. It's going to be, you have non-small cell lung cancer. Let's see what your cells are doing. Let's see what their food is. See what's targeting them. Can we head that off? So it's going to be much more customized, much more bespoke kind of treatments, which I would like to think is going to make better outcomes. I'm not going to say necessarily more tolerable, because the drugs that are being used today, the immunotherapy drugs, are really, really hard on the body, as chemo is. But at least you've got a better chance of it working. Chemo is, for the most part, like throw the mud at the wall and see what sticks. And it's really, really just a gamble. Whereas the new targeted approach at least has a reason and a rationale, working with epigenetics to say that gene is mutated, it's making that protein, it's running that pathway. Can we turn that off? That's exciting.
I agree. And I mean, what it sounds like to me is what you're describing is personalized care, right? It's not a one size fits all. And, being someone I'm a functional medicine practitioner, and I love that we have a lot of tools to help people out. And I agree with you. Not every test is always going to be the end all be all. And I think it's important to, I often think, as someone who questions a lot of things, that, if you have a blood work done, how can you guarantee that, insulin on that chemical assay where they mix it with reagents and do some scientific processing? I don't know all the steps, but how can we guarantee it's the same insulin that's found in living human beings? And I think we got to use it with a grain of salt, like most things. So I'm curious, because you're describing personalized care, how do you approach a session with someone? Like, is it blood work? Is it, we talk about tongue and pulse diagnostics or health histories. How do we begin as practitioners to really get that individualized approach?
That's a great question. And, one of the really interesting challenges of modern technology is doing our work by distance. So tongue and pulse diagnosis is quite challenging when somebody's 1,000 miles away. Well, tongues, you can have them stick their tongue out and come up to the camera. Hopefully the light's good enough. They can take photos of their tongue and send it in for sure. And, that's definitely done. Pulse, no, not really. So honestly, how I work is, I have to say, it's a little bit more mechanistic than that. It's a little bit more cut and dried. When I have somebody in person in my practice, I can do more constitutional assessments. I try by Zoom. My personal training is through the humoral model, the sanguine, choleric, phlegmatic, and melancholic temperaments, which is the old sort of physiomedical approach to the body, the constitutions, and of course to the herbs. Can I show a book? My favorite book at the moment. Oh, well, I would if I could, but I'm going to say the best book I found for this right now, it must be out with one of my students. The best book I found for this right now is the book called The Humoral Herbal by Steve Taylor, who's in England. Steve is a medical herbalist who wrote I wish I had this book during herb school all those years ago. It would have really helped me to get my head around some fairly arcane concepts that are incredibly powerful, very, very simple stuff about the constitutions, really hot, cold, wet, dry, and how those qualities show up in the human body and, of course, in the herbs, and trying to match them. So that is very subjective, and I do some of that in my own practice. However, my practice being largely cancer-based, not entirely. I have an open practice to everybody, but probably 85% at least is in the cancer field. Those patients, they do want custom work. They do want personalized. I'm definitely concerned about their constitutions and how to create better balance in their bodies. But they also have a cut and dried sort of diagnosis crisis thing to deal with. It's not always as cut and dried as we'd like, actually. Sometimes it's a bit murky about how they got into the place they're in or what treatments are being offered them. But be that as it may, I'm usually interfacing quite closely with their doctors. So I ask a new patient to provide me their primary pathology report from the cancer diagnosis, assuming we're talking cancer here, so that I can see exactly what was done to assess the type of cancer. So, for example, in lung cancer, what tests did they run to determine, is it non-small cell lung cancer or is it an other kind of lung cancer? Because that impacts on the prognosis. So I want to see how they did the pathology reporting, how much detail. I want to look at whether they actually did any kind of genetic analysis in that primary pathology. At the very least, I want to look if they assessed for the replication rate of the cells, the mitotic index, because that tells us if your cancer is busy trying to escape and get out into the body and do things, or if it's fairly indolent. You can have cancer, a big cancer, but have it be fairly quiet, not replicating fast, not actually looking for a lot of trouble. And that gives us a greater window to do our work in. If you've got a cancer where the mitotic rate is high, it's replicating very rapidly, it's going to get away from you if you don't do some fairly aggressive treatments. So I look at that. I look at the primary pathology. I look at whether they've had any specialty testing for treatment planning. So was there any genetic screening done? In breast cancer, as simple as estrogen and progesterone testing. So receptor sites. That is pretty standard. I don't think I've had a breast cancer patient in my practice in the last 20 years that hadn't had estrogen or progesterone screening. But I do have patients sometimes who are in very small rural hospitals way up north somewhere. And even with breast cancer patients, they may not have had HER2 receptors tested, which they should, because there's a very effective drug if you have that receptor site. But it isn't actually as routine as you might think. If you work in a city, you just assume it's done every time, but it's not. So sometimes I'm the one saying there's these tests that haven't been done that could inform the treatment planning. So either understanding your condition better or understanding its vulnerabilities to treatments. So sometimes I'll be requesting further testing on the biopsy. They hold those tissues for several years. So I may be requesting more information from the biopsy, and then I definitely look at the blood work. So a patient comes to me, they may have this much blood work. I literally had a gentleman fly in from Vermont last week for an appointment. I don't usually have people fly that far. They'll usually do it by Zoom, but he wanted to come in person, and he literally sent me 2 big 3-ring binders in advance. So what do I do with that? It's like, oh my goodness, okay. The first thing I do is I graph the blood work. So this particular gentleman had sorted, I think his wife really had sorted out his paperwork so well. It's like you would want to have a patient advocate like this, because for the patient, it's overwhelming. They're completely befuddled and bemused. You really do want someone to help you sort out all the papers and put them in a 3-ring binder with tabs and chronological and all of that. So when I received this package, for a moment, my heart sank. And then I looked in it and I thought, actually, this is great because everything's organized, tabulated, chronological, easy. So what I do is I take the most recent blood work and I start from there and I graph that on one page. So I then over time follow up with more graphing to see the ebbs and flows and the changes, one marker against another in proportion. Very difficult if you've got pages and pages you're flipping through. I know you had that test 3 or 4 months ago. Where is it? You know, I have it all on one page. But there's also information in that big fat package that I might need. So I graph the most recent, but I look at it all, I scan it, and I highlight anything else that was tested in the past that would still be relevant or informative to my treatment planning. So it can take me at least half an hour to preview a file before the appointment. Then I do my 90 minutes conversation with the patient, and then I can take a couple of hours afterwards to put the story together, to sort it out, graph it, really think it through, look things up, research, etc. So a full appointment, by the time I add all my time, I'm probably 3 to 4 hours on a new file, which is why I don't take a lot of cases anymore, because I really feel you need to give that much attention. Most of these patients have been really slipping through the cracks. Most patients slip through a lot of cracks in the medical system, unless they're incredibly proactive and, you know, really doing their own work. It's, you know, case in point, patient last week with prostate cancer put on Lupron, which is a gonadotropic releasing factor agonist, and he's getting terrible crumbling of his bones because the Lupron is actually stopping any calcium settling in his bones. Side effect, kidney stones. Well, actually, that's not what you think of when you take Lupron. You think about menopausal type symptoms, but if you dig in the literature, it's actually in there, kidney stones, significant risk with Lupron. But he wasn't told that. It was he and his family that figured this out, and now they are looking at changing the drug. He slipped through the cracks, multiple hospitalized kidney stones, but it's actually coming from the drug. So that's the kind of things we're looking for. We're looking for, is this working for you? How do we measure if it's working for you? If it's not, what else can we do? Sorry, that was a long-winded answer to your question, but
no, I think it's a great response because, yeah, there's so many different factors and it is a lot of work and you have to be kind of your own detective to kind of figure it out. And I think in my practice, you know, it's the people who, yeah, they are willing to kind of do stuff outside of just the session with us that really get great results. And I think too, it's hard nowadays because even as a practitioner, I'll read like the impression from the doctor, and it's heavy and it's complicated reading, right? You have to really sit down with it. And I think a lot of patients, they might get like a grade or a stage or lymph node involvement on their paperwork, and they don't even know what that means, right? And so I'm assuming there's probably a lot of listeners too that, you know, they might be confused by that. Is there maybe a definition that you could provide to people that maybe if they have a certain grade or stage that you could kind of make it more clear for them?
Yeah, I mean, to be honest, I think, and maybe you have the same experience in your practice, a good deal of our work, of my work, is actually explaining to the patient what their medical reports are saying, because they've sometimes got that big stack of literature, but they don't really know what it means. And frankly, they're too scared to really dig into it. It's really frightening when you don't know the jargon. There's these big words being thrown around about you, and you don't know what it means. And most people just like they don't have the opportunity to ask their doctors. You know, the GP average 6 or 7 minute appointment. The oncologist is, you know, if you get 15 or 20 minutes, that's great, but it's usually them talking at you, not answering your questions. So for myself, I spend a good deal of the appointment time reviewing those findings with the patient. That's why I like to see it in advance, so I can go into our appointment. Yes, I'm gathering information, but I'm also really coaching the patient. The root of the word doctor is the root of the word teacher. They come from the same place. A doctor should be a teacher, educating the patient how to be healthier. And so, yes, I spend a lot of time dissecting those files with my patients and saying, you had this test, it means this, and this is what we can do with it. Or you've had this test, and although that number looks scary, it actually isn't significant. Don't worry about it. Or you need to retest that one in 3 months and see if it's changing. So I do build my protocols to some extent on the tests because, for example, every patient in my practice is going to get a vitamin D test. And almost everybody, I live in Canada, northern climate, cold weather, etc., they're all vitamin D deficient. So I am going to be dosing vitamin D, but because there's an upper threshold and you can get kidney stones if you take too much, I want to test again, make sure I'm not overdosing. And then you get the odd patient who can't absorb it. So I have one patient who's been in my practice almost 20 years now. When they survive cancer, they stay in your practice, right? They come in with other things over time. And this woman actually has a genetic defect where she doesn't make vitamin D receptor sites properly. So she's taking 20,000 units a day, sublingual, and just staying in range. And so I wouldn't know any of that if I wasn't running the blood work.
Mm-hmm.
Yeah.
Well, that's crazy. Yeah. It shows again the individualistic nature of everyone. You can't give a one size fits all approach. And I'm curious too, for people that are listening too, there's probably a lot of different interventions that an oncologist might recommend to them, whether that's, maybe chemotherapy, radiation, immunotherapy, and they largely don't know, like, what should I do? Are the herbs or other modalities that I might use safe with this? What would you recommend as far as approaching that subject? And do you have to make a choice like right now today when you go in and see that oncologist?
Yeah, it's a really, really unfortunate place that patients get put into by the medical professionals who make them do either or, as if herbal medicine is alternative. And it isn't. It is collaborative. In its best expression, it is collaborative. We should be able to work with the doctors to say, these are the drugs, these are the pathways those drugs are clearing through, these are the herbs, these are the possible interactions. Whoa, we can get more bang for our buck if we take this herb with this drug. You might be able to get away with less drug, less side effects, etc. So I'm always looking for positive interactions. When I see herb-drug interactions, I'm usually saying, great, thank you. Either I need to get out of the way for the duration of that drug, or let's use this to the patient's greater advantage. So for example, if somebody's taking Herceptin to interface with the HER2 receptors, I want them on a high-dose green tea because it increases the binding of the drug into that receptor site. So you get more efficacy and less side effects because the drug's where it needs to be. Similarly, somebody's taking Taxol, I want to give them Pacific Yew extract because it keeps the Taxol in the target tissues, down-regulating the P-glycoprotein pumps. So herb-drug interactions are definitely tricky. You've got to know your herbs really well. You've got to know your drugs quite well. And that's the biggest problem because actually that information isn't always available. The pathways, the pharmacokinetics, uptake, distribution, metabolism, and excretion of most drugs, no, let me rephrase that, many drugs, is understood, but by no means all. If you read physician's desk reference, a lot, maybe almost half the drugs, the actual mechanism is unknown. They know the outcome, but not quite how it achieves that. And the clearance pathways, does it go through the liver? If so, which enzyme series is it going through? And let's suppose your drug is going through cytochrome P450-2A3, making it up, and you take a herb that inhibits that enzyme pathway. Now, does your drug just accumulate in the body? Could be useful. You might be able to take less drug, but is there actually an alternate pathway it's going to find to get out of the liver after all? These are the questions I run into all the time. I'm not giving answers here. These are questions I come up with. And if I was to give a herb that induced a different pathway, would the drug in fact be able to go there? I mean, and the research just really isn't there. So what does a practitioner do? What does a patient do in that? Well, first of all, you're very careful. You always err on the side of caution. If you don't know, then either don't do certain things or do them slowly. Go in at a quarter dose of one herb and monitor. What are you monitoring? Well, that just depends what you're trying to achieve. But if there's a test, if there's a objective, quantifiable way of assessing your herb, then you should. But that's not always available to us. We don't know the pathways, how the drugs are working. We certainly don't know how the herbs are working. But I'll give you another example of this in my practice. I had a patient recently who developed some very, very significant neurological symptoms after taking some very simple antidepressant, anti-anxiety drugs. And she developed severe neurological symptoms of agitation, restlessness, and uncontrollable movements of the body, like writhing and twisting, and literally lost her job over this. And she started on a very simple antidepressant. The patient was highly motivated and found her way to a forensic psychiatrist who works with people who are incarcerated for heinous crimes conducted while under the influence of pharmaceuticals. That's the person's specialty, is what drug did you take that flipped you to being homicidal? And is that justifiable excuse in court of law? Mm. So my patient found their way to this specialist. They ran a bunch of genetic testing and discovered that the patient was unable, genetically incapable of metabolizing most of the SSRI drugs and other related antidepressant and anti-anxiety drugs. She either induced, her enzymes in the liver were either induced or inhibited by her genetics. Had they done those tests before putting her on these drugs, she would have not had 2 years of absolutely horrendous health. I mean, it's been a catastrophe in her life. She's coming out of it now. But my point is, why would you not run predictive tests before embarking on a life-changing treatment option? And life-changing can be very good. It might save your life, but it can also be very detrimental. And there are tests to know that. So I guess what I'm really saying, you were asking about, how do we deal with the herb-drug interactions? And, fundamentally, it is a risk. Every time you have a pharmaceutical in your body, are you being told, do not eat because it might interact? No, you are told don't take grapefruit juice with certain drugs because of the known interaction. What about apple juice, pineapple juice, tomato juice, orange juice? I mean, we just don't know. So for me as a practitioner, I always err on the side of caution. I always look for if there's a way to monitor or measure if something is changing, good or bad. If I introduce a herb, how do I know what it's doing? I always look at the clearance pathways of the drugs as much as that information is available. I always look at that and the pharmacokinetics of the herbs. Very little is available. I start with low dose. I build up doses over time. And I'm always aware that there is really nothing I can do with my herbs that could be worse than the drugs. And I'm not saying that facetiously. I'm not making light of the concern. It is a concern, and we do have to be very careful. And that should not stop us doing our work. We're professionals, we're trained, we're clinicians, we know what we're looking for, and we are cautious, but and still very capable.
I agree. And yeah, I think when someone looks at, a drug's information level, like we have black box warnings, for example, I mean, they're there because at some point in time, like if death is one of the warnings, at some point in time, it probably caused that. And I think people, when they approach herbs or supplements, they often worry, what is this going to do to the drug I'm taking? And like you said, those drugs are very strong, and not that we want to be brazen and just take whatever, but oftentimes I feel like if we're taking full spectrum herbs, not isolates per se, but we're getting a lot of constituents, and we're not taking them in these huge amounts, it's very safe, generally speaking. And if you're doing your work and doing a health history and communicating actively, I think it leads to, in my experience, just better outcomes. And people often tell me a lot of times the side effects from maybe their treatment seem to reduce or go away. And I think that largely, like you said, all those different types of juices, we want to pretend like we know for sure, but there's a lot of variables out there if we wanted to follow the scientific method thoroughly that we just don't know. And I think that's also part of the work, is admitting that we're we're not always sure.
Yeah. Yeah. And I think we also have to understand that the scientific method is not as rock solid as it's presented. There are variables, individual people, even if you do a huge clinical trial with, 500 people in it, they are all slightly different. And most of those studies, they will very strongly control the drugs you're taking. They may ask you to come off all your supplements, but they're not controlling your diet. They're not actually saying, don't eat this, eat that, etc. It's actually not as controlled as it's presented. And furthermore, those clinical trials they are not assessing the individual, for example, for their liver clearance capacities before determining the drug dosing. So they are running trials as if it's one size fits all medicine. But you well know, Aron, in clinical practice, a patient gets set up on their chemo protocol. You're going to have 6 rounds. It's going to be this dose for these many days off. And halfway in, they can't tolerate it and they bail. And their doctors will say, you can't have any more. It's making you too sick. So there's no absolutes. Medicine is halfway to customized already just by the fact that patients run their own lives, and trying to fit a square peg in a round hole, it's usually not a good fit.
I absolutely agree. Yeah, I feel like even as a practitioner nowadays, you're almost kind of expressing an art form, an intuition, right? Because a lot of times too, I think even the person in front of me, if I say, what do you think would really work well for you? A lot of times they honestly know, right? And I think having them be a part of that conversation is a really important thing, because they do get disempowered from
very much so,
being afraid of the medical system.
Yeah, being told what to do, no chance to ask questions. It is infantilizing, and
yes,
no controls. You sign up to conventional cancer treatment, and you've basically signed up to not knowing what's going to happen next and just going along for the ride. And I think our job is not to say that that's right or wrong, or they should or shouldn't be doing those things. I think our job is to honor that process, help them make informed decisions, and then maximize the opportunity for benefit. So whatever they've decided, I'm never going to say to a patient, do not do chemo, do not do radiation. But I might say to them, for these reasons, that drug doesn't sound like the right one. Have you investigated this? Have you had these tests? Can you ask for such and such? Or, again, another example. This was a great example really recently last week. I have a patient who's a younger woman receiving lung radiation into her lung. She has a metastasized cancer in her lung, and it's near the heart. And so she's going to have radiotherapy, and we've all agreed that this is the right treatment choice for her for all sorts of reasons. But the risk is that when you breathe, your lungs are moving. And so your focused, targeted beam is no longer focused and targeted. Every time you breathe, it's getting scattered into the chest and damaging the heart. So there is quite a bit of interesting research now about training people to breath hold during radiotherapy. And in fact, the studies that I've been looking at, this was from 2020 and 2021, really current stuff. They're looking at training people, filling them with oxygen, and then having them hold their breath for 6 or 7 or 8 minutes at a time. And then take hand up, beam goes off, take 1 breath, hand down, hold your breath, beam comes on again. So in the course of 1 hour of treatment, they might actually be holding their breath as much as 40 minutes through that 1 hour of treatment. And I read this, I was like, wow, that's really exciting, really, really interesting. Less movement in the chest, less scattering of the beam, less collateral damage. So I contacted my patient who's in the UK about this, saying, you're going in for left chest radiation. This, I don't think there's enough time to do the special training, but at least talk to your doctors. She got back to me and she said, well, we're ahead of you, she said. They've already taught me how to do this and set up the hand signals, and that's how we're going. And I was like, wow, fantastic. So the research has only been out a couple of years. That particular hospital in Scotland has already jumped on it. And those are exciting things for us. How simple to teach someone to hold their breath.
I think that's great because, I mean, at the end of the day, you're giving people options, which I think is a huge thing. You know, usually the medical model, they have to recommend, you know, surgery or a type of like chemo, for example, or other intervention. And yeah, you're giving them herbs, diet, supplements, you know, breathing methods, a whole different lifestyle approach. And I even in my practice, I was lucky enough a couple of years ago to train with the Physicians Association for Anthroposophical Medicine. So talking a lot about like mistletoe therapy for folks. And I mean, I can't tell you how often I'll ask someone, have you heard of mistletoe? Have you heard of some of the other herbs in the practice I might use? And a lot of them largely aren't aware. And I think that's a large thing of empowering people, just to give them, you know, an option that's not, you know, these allopathic interventions always.
Yeah.
And so I'm curious because there's probably people that are anxious to use herbs in their practice too, and they probably aren't sure where to source things. And as a small business owner, I always like to remind people that, you know, small businesses usually need those supports, but should someone contact a local herbalist to source herbs from, or could they go into a health food store and get stuff off the shelf and get the same results, or how should they even approach that?
It's a great question. Thank you for bringing that up. And I think the answer is a little bit of everything. For your day-to-day health concerns, the things that you can reasonably self-assess and self-treat, the kinds of things that you would naturally go to a drugstore and buy something over the counter, those things you can do with herbs. Coughs and colds and owies and bruises and sprains and minor infections, those things that anybody would self-treat, you can be using herbs just as well as drugs for that. And self-care with herbs would mean going to the health food store, reading some magazines or literature, asking advice in the health food store for day-to-day simple things. If you have a condition for which you would normally ask for some advice from a pharmacist, a nurse practitioner, or indeed a doctor, then you should consult a professional herbalist. So there's a little bit of self-sorting in there. Do I need advice or not? Can I fix this on my own or not? If it's a fix-it-yourself thing, by all means, choose your herbs, go for it. If it's the kind of thing you would ask advice from a healthcare professional and you want to be in natural medicine, consult with a herbalist. And of course, I would recommend someone who's qualified and competent. How do you know that? Well, you know, in the United States, it's probably a registered herbalist with the American Herbalists Guild. In each province in Canada, each province has its own associations with their professional designations. And most countries will have an herb association with a professional designation. Doesn't mean that there aren't some great herbalists out there that aren't in the associations. But it's harder for the public to know. It's harder for them to sort out. You know, yes, you can fix your own car, fix your own brakes and do everything. Your neighbor can do that for you, or you can take it to the garage where they've trained and they have the equipment and the tools and the insurance if it goes wrong and your brakes fail on the hill, right? Insurance might be too little too late by then. But you know what I'm saying? You can do help yourself at home, or you can consult somebody. And if you're consulting somebody, you should try to figure out if they know what they're talking about. And if they're not a member of an organization, it's harder for you to measure that. That's really all I'm saying. There absolutely are times when a practitioner is required, and not dissing anybody here, but a novice, newbie herbal practitioner is probably not who you want to go to for your cancer care. What I recommend for any of our listeners who are practitioners but feeling a bit nervous about working in the cancer field, then I would say that's an appropriate response. You should be nervous. It is a big deal. Is it bigger than everything else? Well, I mean, if you get it wrong in cardiology, people have rather acute responses. You know, if it's skincare and you get it wrong, they might be uncomfortable, but they're unlikely to be, you know, life-threatening. But cancer, yeah, you've got some big disease, some big drugs, and some urgency. I definitely recommend that if you're a novice practitioner and patients are coming to you with this sort of thing, which they will, I recommend a mentor. That's what us experienced practitioners offer to the newbies, to the newly graduated practitioners who are competent, well-trained, safe, not necessarily incredibly effective yet because they just haven't had their, enough water under the bridge to have learned all the tricks of the trade. So I and many of my colleagues will offer mentoring to practitioners in the American Herbalists Guild. It's actually part of the guild membership. When you come in as a new member, you're invited into a mentorship program. In the United Kingdom, the National Institute of Medical Herbalists require you to be 2 years in the mentorship program after your college, after all your schooling, so that an experienced practitioner can sort of take you under their wing a little bit and guide you, not just in the herbs, but also all the business management aspect and the personal relations and all the things ancillary to the actual practice, although that's also mentored. So for me, I run mentorships all the time. Right after we finish this call, I've got 2 more calls lined up with folks who are qualified practitioners, but stuck on a case. And in some of them will ask me one-off for a case that they want to have a second opinion and bounce around. Others will actually book a series of meetings with me to review a series of cases. Some of them are study groups, and I'll have 4 or 5 herbalists who've got together, once a month to come in for a call where we look at cases and review conditions and what have you. So all I'm really saying is that no one of us knows it all. No one of us knows enough, actually. Part of the trick of being a good practitioner is knowing what you don't know and how to reach out and ask for help. I myself have a mentor as well. I go every 2 weeks into a hour-and-a-half mentoring session where I get to ask my tricky questions and get advice. You also asked, Aron, about suppliers. So let me say a little bit there. For your day-to-day cuts and colds and bruises, yes, the stuff in the health food store is probably acceptable. Some of it's very good. Some of it's less reliable. In Canada, your products, if they're sold in the stores, need to have an NPN, a natural product number. It's a licensing that the Canadian government requires for natural products being sold in the open market. If you're a practitioner, you don't need to have that in Canada. And of course, in the US, you more or less can sell anything with your disclaimers on them. Although in both countries, everything has to be made under clean, hygienic circumstances, good manufacturing practices, and all of those things, traceability. One of the problems when you start working in actually really treating conditions as opposed to preventative maintenance kind of healthcare, once you get into actually, providing remedies to people, quality is absolutely paramount. If you don't know exactly what you've got in your bottle and it's consistent from one bottle to the next, you can't really do your work. You can't be just throwing things at people and hoping that it's the right amount or the right dose, whatever. So I purchase most of my products because manufacturing good quality herbal products is a whole art unto itself. It's a whole profession unto itself with a lot of skill set, a lot of expertise, a lot of equipment. And I've chosen not to make that the priority of my work. So I purchase most of my products are coming in from England because that's where my training is. They have super potencies, highly concentrated, practitioner only kind of products. In North America, there are many, many, many different suppliers of herbs, but there are very few suppliers of the really interesting anti-cancer kind of herbs, the cytotoxic herbs. Those are much harder to get. So yes, you can make your own. I now have somebody making my Pacific yew extract for me. I live in the Pacific Northwest. She's harvesting fresh yew and making a 1 to 2 fresh extract to my specifications. But I purchase others. I don't know that this is the right venue to start naming brands and telling you where to go, but I will say that some of the herbs I'm using, some of the herbs I wrote in my book, are not in the stores, and they shouldn't be in the stores. I did give some suppliers in my book, but these are for practitioners. They're not for the open market. So at that point, I would say consult a herbalist, and they will be able to track down some of these unusual herbs that are not routinely available.
I think that's a great point, because I think, in the manufacturing realm, I mean, there's a lot that, if you're a herbalist and you maybe forage like I do and you make herbal products, it feels more enlivened a lot of times. I feel like, to me, it feels fresher, and it's nice to have that relationship with the plant, right? But then at the same time, you don't have this standardization that comes sometimes with these bigger companies. And I think if anyone's a good practitioner, they do question, like, am I giving things to people that are making a big difference? And what can I do to improve the efficacy of that relationship with them? And I think, like you said, it's important to have relationships with local people, but then also some good companies that are out there. And yeah, I think even, if you go in the marketplace, like there's a great book called The Business of Botanicals, where if we read these books, I mean, sometimes it's scary to think about just kind of how the herbs are left and kind of neglected and shipped overseas and sat in warehouses for years. And I think they lose that energy to them. Yeah. But then there are great companies that, are practitioner grade, that, they can guarantee some high potency things. And I think it is good to, develop a relationship with a practitioner who's aware, I think, of both sides of those.
Yeah, I think that's very true. There's definitely some excellent products in the marketplace, and there's some absolute rubbish. And I think to some extent you get what you pay for.
Yep.
And I definitely don't recommend buying your herbs off the internet, unless it's a branded product that that company and you can find them on Amazon or whatever, that's fine. But if you're just, looking for a tincture and you go out on the internet, good luck. Making your own is brilliant if you have the access to the herbs, the time, the space, etc. But it's very hard to make super concentrates at home with basic equipment without having specialty equipment. You're going to end up, most of your tinctures are going to be 1 to 5, 1 to 7. Mine, what I'm working with in my dispensary, are mostly 1 to 1 and 1 to 2. You can't make those without some gear and some expertise and some training. So I do actually tell my patients it's worth spending the money. It's just like food. You can go and buy rubbish food in a cheap store and it won't serve you. It would be better to eat less of it, but have higher quality. And it's really the same with the herbs. What I personally do is I make a lot of topical products. I make a lot of the infused oils, turning them into salves and liniments. I do a lot of poulticing and packs and things like that. But I also, because I have land, I'm growing about half of the herbs for my tea blends. And in my practice, every patient gets a tea. They have to actively ask not to. And this goes back actually a lot, Aron, to the whole Steiner thing and Goethe about having a relationship with the plant. So I want my patients to know that it is plant material that is helping them, not just another potion or pill in a package that could just as well be a drug, really. I want them to have a deeper and more meaningful relationship with the natural world as part of the healing journey, to feel reconnected to this planet. Many of us are really so distressed and distraught by the state of the world, we're kind of starting to leave the planet in a way, like absenting ourselves, like it's too big, we can't fix it, so let's ignore it, And in that, there's this whole phenomenon now, maybe you've read about this in the world of psychotherapy. There's a whole new thing getting talked about now called plant blindness. And plant blindness, it's literally a psychotherapy term now for people who don't notice nature. And if you don't notice something, you don't take care of it. It's irrelevant. It doesn't matter if it's flooding and burning and desecration by oil spills. Who cares? Like, you're not really aware. So plant blindness is considered to be a psychotherapeutic phenomenon now. It makes people ill. It makes them psychically miserable to be disconnected from the source of life, even though they intellectually don't realize. At a spiritual level, this is devastating. And so a big piece of my work is trying to reconnect people back to spirit, which really the avenue to that is through nature. Many of us have forgotten how to be spiritual beings on this planet. We're all about grab and go, more, me, more. It's all about my needs. And trying to slowly, my job on the planet, small task, is to get people reconnected back to nature. And so in my clinic, I do that by providing actual herbal teas, not tea bags, but actual loose herbs. I try and make them tasty. My patients might disagree with that. I try and make them beautiful. I put flower petals and things in so that they have a heartful connection to nature, and it hopefully makes them more aware of everything of how they operate in the world, including things like the food that they choose to eat, choosing to spend money on organic, less packaging, etc., just by giving them a herbal tea. My not so very hidden agenda to change the world.
I think it's one of the best things you can offer because, yeah, that's kind of the undefinable, right? We don't necessarily have that on the lab value, the spirit or essence of someone. And yeah, I think, plants have been around for 700 million years. And I think we definitely have an intertwined path with them. And yeah, if you read Steiner, he talked about our sense systems, right? Our sense organs. And it wasn't just, do you see something? It was largely had to do with not only developing as an adult, but lots of different aspects of just, our interconnection with the divine and life and how we're interplaying with that. And I think that is something that we need to get back to more and more and more and find subtle ways throughout the days to, go for a walk, go for, a time in nature, ground, get in the sun and realize that, there's this beautiful world that's larger than some of our concerns. Yeah.
What an amazing chat, you two. This has been awesome. Aron, you should host more of these for me. You did a great job.
Yeah, Mason, thank you.
Really appreciated listening to both of you speak. And I want to leave a few minutes. Chanchal, I know you have somewhat of a time crunch here. You got some calls coming up. Do you have time to tell us about your upcoming events?
I absolutely do. And I'm also going to say, Mason, that because Aron is coming to stay for a couple of months, maybe we should do some podcast from the garden while he's here.
That would be awesome. I would love that.
A lot of fun. Yeah.
Let's do it.
Yeah. So thank you for the opportunity to meet with our audience today. Always appreciate it, Mason. And you did ask me to mention a couple of things coming up. So for anybody that is listening that wants to come and meet Aron and me in person, you are welcome to come to our Vancouver Island Herb Gathering, which is the solstice weekend in June, the 21st, 22nd, 23rd. We're having a party and you're invited. It is the Vancouver Island Herb Gathering. You can find out information at herbconference.com. And it is a couple of hundred people, probably about 250 people, for 3 days of herbaling on Vancouver Island with all kinds of speakers, teachers coming from all over, all kinds of activities, kids program, fun competitions like the Sniffathon. We're going to have a alpine herb walk and a whole lot more. So there's that in June solstice weekend. And then at the end of July, last couple of days of July, first couple of days of August, I am very excited to have my very dear and special friend, Kat Meyer, coming to stay. Kat, of course, is the author of Energetic Herbalism, a wonderful book that came out a couple of years ago. And Kat is a herbalist, a herbal teacher, a nurse practitioner. No, actually, I take that back. She's a physician's assistant as well as a herbalist and a herb teacher. And Kat is going to be here for 5 days. she's going to be teaching 3 days with me on clinical skills and then 2 days on Steiner and Goethe's approach to herbal medicine. She didn't call it that, but actually that's what we're going to do. We're going to be doing plant meditations and plant studies for a couple of days together. So anybody that's interested in that, you can find out more on my website, which is just my name, chanchalcabrera.com. And we'd love to see you here at the farm or in some other podcasts at some point.
Very good. Yeah, Kat's wonderful friend of HerbRally. She's been on the show as well. And I got to say, herbconference.com, that's one of the best URLs I've ever heard of. When I was organizing the Brighton Bush Herbal Conference, I want to say we got herbconference.net. So is you, Chanchal. You took .com. So, but sounds like a blast. I'm stoked Aaron's going to get to join you. Hopefully Aaron could be there for the cat event too. Not sure if you'll be there for that, Aaron, or not, but the Cat Meyer event. But I would also like to take a couple minutes to let Aaron, kind of plug and promote his practice as well as the show. So Aaron, can you tell us a little bit about your practice and all that you do?
Yeah, for sure. Thank you, Mason. So yeah, I have a private practice here in Indianapolis, Indiana, where I do functional medicine and herbalism. I think largely, revolves around helping people, kind of like what we discussed, navigate, diet, supplements, herbs, lab work. I mentioned too, mistletoe therapy. That's something that I began offering recently after my training with the Physicians Association for Anthroposophical Medicine. I'm starting to do a lot more also with trying to get more involved in like old school osteopathy, more like the hands-on manipulations and cupping and that realm. If I took my shirt off, you'd see about 200 cup marks on me from a training outside this weekend. So yeah, starting to get more into doing some more manual support for the people that come and see me. So that's the private practice side. I do sell a line of herbal tinctures and tea blends to health food stores. I do plant walks in the area and really love that. I love teaching people about like what we were chatting about, connecting with nature and really learning kind of where some of their supplements or herbs do come from. And then I'd say lastly, yeah, I do offer a podcast that me and a functional medicine chiropractor here in Indiana produce together. It's called Awaken Indy. And we focus on all the local practitioners here, whether that's in the holistic care scene or we do a lot with regenerative agriculture. I head up the Weston A. Price organization here for Indianapolis. And so I try to connect with local biodynamic and organic farms. And instead of prescribing medicine, I prescribe farmers instead. And that's largely what I love talking about is also, how can you grow the things that you eat every day? So if people are interested in connecting, it's Heartwood. It's spelled HART, heartwoodherbals.weebly.com. You can email me at heartwoodherbals@gmail.com. I'm also on Instagram. And then the podcast is on a bunch, Spotify, I think Google, and they can check it out and just, on the favorite platform and connect that way.
Thank you so much. Well, you're both brilliant, beautiful, lovely human beings. It's an honor to know both of you. You're doing amazing work. Thank you so much for joining us on the Herbalist Hour. Big shout out and thanks to Amanda for editing. And that's going to do it for this episode. We'll see you next time.
Thank you so much, both of you.
Thank you very much. Thanks so much for watching today's episode of the Herbalist Hour. If you enjoyed it, please give it a thumbs up. And if you want more great herbal content, be sure to subscribe to our HerbRally YouTube channel. If you enjoy these Herbalist Hour episodes and you'd like to join us live, you can do so by becoming an HerbRally Schoolhouse member. Learn more at herbrally.com/schoolhouse. And if you want to get your first 30 days for free, use coupon code YouTube30 at checkout. So our HerbRally Schoolhouse members get access to exclusive video classes, monographs, and a lot more herbal community discounts, along with joining these live Herbalist Hour interviews. So one more time, herbrally.com/schoolhouse, enter coupon code YouTube30 at checkout to get your first 30 days for free. All right, we'll see you in the next episode and take care.